Welcome to this episode of Ask Dr. Blosser. The question before us today is, how does marijuana affect the GI tract? Marijuana, as a known hallucinogen, affects the GI tract through two receptors, the CB1 and the CB2 receptors, which are in the GI tract. Marijuana has known to stimulate appetite, and that's why many people who imbibe oftentimes have multiple issues with the munchies after having consumed cannabis and cannabinoid-containing products. On the other hand, there is no real clinical evidence at this point that marijuana or any of its constituents in cannabis have any positive effects in well-controlled, double-blind, placebo-controlled trials on the GI tract. There is some evidence that in inflammatory bowel disease they may ease the pain and suffering from an active flare of disease. On the other side, there is growing evidence that cannabinoid-induced hyperemesis syndrome, which is refractory nausea and vomiting that can be induced through these CB1 and CB2 receptors on the stomach and the GI tract, can lead to profound nausea and vomiting even after having not consumed or smoked marijuana for up to a month. So there is no good evidence at this point that cannabis has any positive effects on the GI tract. But it does have significant deleterious effects on the GI tract and should be avoided at all costs in patients prone to nausea, vomiting, and weight gain.